Hello, everyone. Thanks for joining us at the ARC of Fort Bend County Parent Education and Support Group meeting on Zoom today. I'm Carrie Axtell, the Advocacy and Youth Programs Director. Our group meets virtually on the second Thursday of each month, typically, but here we are on the fourth Thursday. So thanks for meeting us here on this day instead. But we do meet throughout the school year, and we usually have a great educational presentation, and today is no exception. I invite you to stick around afterwards for the support group portion if you'd like to ask questions or share some of your experiences and just seek additional resources. I will hang around afterwards to talk with you all. A little bit about the ARC of Fort Bend County. We're a nonprofit organization established in 1968 for people with intellectual and developmental disabilities. That means this is our 55th year of being here in Fort Bend County and advocating for people with IDD. We ensure opportunities for people with IDD and their families to help maximize their quality of life within our community. We did that through disability rights advocacy for and with people with IDD. We provide information about community services and resources, help organize and support resource fairs, support groups for parents, as well as our teen and adult sibling group, which we have here at the ARC of Fort Bend. We also hold several social and recreational programs for people in their teens, 20s, and into mature adulthood. We're also home to the largest Special Olympics delegation. We have 11 different sports, over 130 athletes. So it's a lot of fun. So if you'd like to learn more, please visit our website at arcoffortbend.org or check out our Instagram and Facebook page as well. You can also reach out to me. I'm happy to answer questions, and I'll put my contact information in the chat box here in just a moment. If you have questions during the presentation, our presenter, Maribel, says that you're welcome to chime in if you have a question throughout the presentation. If you're a little more shy and you want to use the chat box, you're welcome to use that as well. But I will also share those questions with her either throughout or at the end of our presentation as well. So again, if this is your first time joining us, welcome. We do have some exceptional professionals here in the community share their knowledge and expertise with us. And this month, we are very pleased to welcome Maribel Burgoa. How do you pronounce your last name, Maribel?
Burgos.
Burgos. Okay. So Maribel Burgos, and she's with Texana, the Authority Services and Practice Manager there at Texana Center. And she's going to be presenting about Community First Choice. Maribel has worked with the developmental disabilities community for 12 years. She's gained experience through the waiver provider and authority services. And her involvement with Community First Choice started when it began in 2015. And that's where she facilitated the implementation process for community centers. And she served as a member of the Texas Council CFC work group. Her work continues today as a CFC subject matter expert by organizing regional CFC focus group meetings in the greater Houston area and collaborating with several managed care organizations. She holds a Bachelor of Science for Human Development and Family Studies and a Master of Public Policy from the University of Houston. So welcome, Maribel. Thanks for presenting to us today about this very important topic.
Thank you for having me today. I'm really excited to be here. I'll just go ahead and get started. Today, we're talking all about Community First Choice. And just to kind of give you guys an overview of what I'll be talking about today, we'll talk a little bit about the background and the program impact, eligibility requirements for CFC, services and settings, the functional assessment, our role as the local authority, and then, of course, how you can access these services. So just a little bit about the background. It started back in 2013 from the Texas legislature, basically required the most cost-effective approach to basic attendant and habilitation service delivery. So HHSC met this requirement by implementing Community First Choice. It officially started on June 1st, 2015. And CFC services are available through waiver and non-waiver programs as well. Through managed care, some of the waiver programs would be like Star Plus waiver, your 1915 CIDD waivers, you'll know them best as HCS, the Home Community-Based Services, and Texas Home Living. And then, of course, it's also offered through the YES waiver, which is the Youth Empowerment Services. And it provides intense community-based services for children with severe emotional needs. So kind of to give you an idea, a little bit about CFC waiver and then CFC non-waiver. So if you're receiving CFC services through a waiver, your chosen waiver provider is the provider who's going to be providing these services for you. It's also offered through the CDS option, which is the consumer directed services option. And then as a local authority, we're conducting the assessment and then ongoing targeted case management for individuals. If you're receiving CFC through a non-waiver, your CFC provider would be contracted with your managed care organization. And I'll talk a little bit about the MCO activities and how they're involved with CFC non-waiver in a little further down. Services are also delivered through the consumer directed services option. Our role as the local authority for individuals receiving CFC through the non-waiver, for age 21 and over, we conduct the assessment, and then we also provide the ongoing targeted case management for the individuals. I'm looking through my notes to make sure I didn't miss anything, because there is a lot of information and I want to make sure I touch base on all of it. Let me see. So for the waiver program, if you are receiving services through the waiver, it can't be in combination with any residential type service. So, and I'll talk a little bit about the settings later, but just so you know, you have to be living in your own home, family home, in order to receive the CFC services. For eligibility requirements, you have to be eligible for Medicaid. You need to have some type of help with activities of daily living. So you need help with dressing, bathing, eating, even includes some instrumental activities of daily living, such as money management, any like housework, cleaning, laundry, shopping, meal preparation. You need any assistance with those types of activities, CFC is, a service that could benefit you. And then you'll also need an institutional level of care. So I'll be referring to that as LOC. But there is no age requirement for CFC. And moving forward, I'll be focusing mainly on CFC as a non-waiver. So when I'm speaking, you don't have to be enrolled in a waiver program again for CFC services.
Okay, and that actually lends itself well to the first question that Grace asked about, can a parent apply for CFC even though the child does not have Medicaid yet? So we're kind of presuming the reason why the child doesn't qualify for Medicaid is probably because the parent's income is counted, right?
Yeah, so the child has to have Medicaid.
Mm-hmm. So I'm sorry, let's say the child never applied Medicaid before, but they don't know whether or not they qualify for Medicaid. So at the same time, can the parent apply for CFC with the local authority, and then the local authority will be able to apply CFC and Medicaid together for the family? Is that okay?
Yeah, I think you're talking about maybe kind of going through the process of both, like kind of going through the Medicaid eligibility process in congruent with, seeing if you would qualify for CFC services as well. Well, one of the issues with that is because when you're with CFC non-waiver, we work closely with your managed care organization.
Quick question is,
so that's United Healthcare, AmeriGroup, Molina, and so one of the first rules for eligibility is you have to have Medicaid at the time that we're pursuing that enrollment to CFC.
Yeah, for my daughter's case, she is on the long waiting list since she was born on the HCS waiting list, but she is qualified locally by your criteria. meet all the requirements. I don't know when. I thought just waiting for you guys to put on the queue. Looks like she is really qualified for the CFC, but I never heard that this program, because Texana have her files, everything have the in primary assessment, and with all the physical disability and the mental disability. I don't know how her case manager, because she was on the HCS waiting list, but we never heard from you guys.
So maybe it sounds like for what the parents, in order to see if they do qualify for community first choice, first thing is to apply for Medicaid, right? That
Yeah,
sounds
she
like
has
that's the first
Medicaid.
step.
She has
She has-
Medicaid already.
Okay, so
She
your
has
daughter currently
Medicaid
has
through
Medicaid?
the
All right,
through the medical dependent kids program, because she has some special medical condition.
okay, so she
She
is
was
receiving a
qualified.
waiver then.
Yeah, she
She
has.
has medically dependent children program, you said?
Oh, that was previous years. Now she is in the class.
Now she's in
Okay.
class. Okay,
Okay, so
yeah.
she's receiving a waiver then.
Yeah, that's
Okay.
that's about the 5-6 years ago started from the MDPC program. But what I can ask you guys is because you guys have all her file and you because the long waiting list for the HCS program, but the medical dependent and the class waiver get her quicker than your queue. That's why she gets those services. But look at all criteria, she does qualify for the CFC. But because she is in your files, why your organization never contacted us to refer this program for us? You know what I mean?
She can receive CFC services through class waiver. So you'll need to talk with your case manager and see how she can get CFC services. So what I'm focusing on today is mainly for individuals who are not enrolled in a waiver program, and how can they access these in-home supports while they're still kind of waiting for their slot for the waiver.
Okay, I see. Okay, thank you.
Okay. So like I said, there is no age requirement for CFC. The local authority, we would be responsible for completing the assessment and providing ongoing case management for individuals aged 21 and up. For individuals 20 and younger, case management is typically done by the managed care organization. And as our role as a local authority, we are still responsible for determining eligibility and renewing that eligibility annually. So kind of going back to a little bit about the level of care. So your LOC is determined by the determination of intellectual disability, also known as DID or a DID. And it's a psychological evaluation that lets us know what the diagnosis is. Unfortunately, the state says, if anyone is going to receive any type of state-funded services, they have to be evaluated by a state-authorized provider. So at Texana, we do have psychologists here who do our psychological evaluations for us. And so if you haven't had one done yet, and there's a need for services, you definitely, I would reach out to our intake services. So for CFC, they have to qualify as an LOC1 or an LOC8, and then an LOC1 is identified by an IQ of 69 or below, or an IQ of 75 or below with a related condition. And then an adaptive behavioral level, ABL of 1, 2, 3, or 4, which is mild to extreme adaptive behavior deficits. And then the LOC8, you would qualify by having a related condition. LOC8 doesn't take IQ into consideration, but you do have to have an ABL of 2, 3, or 4, which is moderate to extreme adaptive behavioral deficits. And so local authority, we complete what's called the intellectual disability related conditions assessment, an IDRC, to determine if you would qualify under the eligibility requirements of the level of care. And then just to kind of go back, related condition, that's typically your diagnosis as cerebral palsy or epilepsy or any other condition other than a mental illness that's found closely related to an intellectual disability. And so services offered through CFC, you have 4 services: personal assistant services, habilitation, emergency response services, and support management. Personal assistance services are those hands-on assistance with activities of daily living. And so, you know, hands-on with bathing, grooming, dressing, feeding, toileting, that's going to be your personal assistant services. Your habilitation is more of an enhancement of skill. And so this is that training piece. So I'm going to, teaching these activities like self-care tasks, personal hygiene, household tasks, mobility. So more of, I'm going to teach them, you know, money management. We're going to work on, you know, using adaptive equipment, things like that. And then emergency response service, I like to best describe that as kind of like that push call button in the event of an emergency. It is typically for members who may live alone or who are alone for significant parts of the day. This is provided through your managed care organization. And so different managed care organizations might have different types of emergency response services. There could be a separate device that you kind of push to get emergency response, or I've also seen where they hook it up to your cell phone service. And so it's there with you at all times. And then support management. It's a one-time voluntary training on how to select, manage, hire, and dismiss attendants. And it is offered to all members regardless of your service delivery model. And then also it's typically, again, for individuals who have no one to speak on their behalf, who probably higher functioning individuals who would be responsible for choosing their own attendants to work with them. And so a little bit about the service delivery models. There are 2 ways. Once you are enrolled in CFC, there are 2 ways to receive the service. You can either go with an agency provider option, or you can go the consumer directed services option. And so the agency option, the services provided and managed by agencies contracted with the MCO. You would be given a list of provider agencies from them, and all CFC services are available through this option: the personal assistant services, habilitation, support management, and the emergency response. And then through the consumer directed services option, the family is responsible for hiring, managing, and dismissing attendants. You would receive a list of what we call financial management service agencies, FMSAs, and then they would assist with some of the other functions such as payroll and things like that. And then through this option, only the personal attendant services, habilitation, and support management are available. So as I mentioned before, in order to receive CFC services, you have to be residing in an allowable setting. And so some settings, if you are currently living in any type of nursing facility, hospital, intermediate care facilities, any group homes, those are not allowable settings. So you have to be living in your own home, family home, in order to receive this service. The functional assessment. So as I mentioned, for individuals who are aged 21 and over, the local authority, we are responsible for conducting the functional assessment. We do this through the person-centered planning process. The assessment determines basically the amount of personal attendant services and habilitation hours that are needed weekly to meet the individual's needs. It outlines the members' needs, the goals, what they can do, what they can't do, based on several different tasks. And it is updated annually for our individuals. For those that are aged 20 and younger, again, the functional assessment is completed by the managed care organization. So our role as the local authority, we are responsible for conducting the DID. We are responsible for completing LOC eligibility determination by completing the IDRC assessment. We do it initially and annually for all members. Is my sound okay? Okay, Carrie, is my sound okay?
It cut in and out just a little bit.
Okay, I got a sign that said my internet was unstable. So just
Yeah.
let me know if my sound goes out or what.
Okay.
So as I mentioned, our role as a local authority, we do complete the IDRC. We do it initially and annually for all CFC members, regardless of age. We send, a copy of the DID and the IDRC to HHSC for approval. And then we develop the functional assessment, and we collaborate a lot with your managed care organization, your MCO, into in agreeing and jointly presenting a service plan for members. And that's basically talking about how many hours are approved per week and then per year. And then we also provide ongoing case management for those members aged 21 and older. Some of the other activities, like I said, we work closely with the managed care organization. So they are responsible for maintaining a network of credentialed providers. As I said, they provide families with a list of who they can choose to provide to give their CFC services to. And then we also work with them in authorizing the services. And they also provide assistance with accessing, providers. And so a lot of the issues that we run into with families is, well, I don't have anybody to, to come in and provide these in-home supports for my child. And so the MCO, again, gives you a list of providers. And with those providers, they have contracted employees who could potentially be an attendant for you. Another issue that we, not really issue, but another thing that we run into is families are like, I already have somebody. I know them and I trust them and I want them to work with my child. Can they be the attendant? And the answer is yes, absolutely yes. If you have someone in mind to be providing the service, they would need to, once you've chosen a provider, or you can go the CDS option, but once they've chosen a provider, if you have someone who you would want to work with them, they would need to become a contracted employee with whatever provider that you chose. and then they can essentially start getting paid for providing those attendance services through CFC. And then HHSC, they're responsible with just all of the oversight, contract oversight with the MCOs, contract oversight with us, the local authorities, and then regulatory oversight for waiver providers. And then they also authorize that LOC determination annually and initially. And so for accessing services, contact your local authority. I have our contact information up there. Feel free to call us anytime if you have more questions, if you feel that you would qualify for CFC, or if you're just interested in seeing if the eligibility criteria or whatnot, give us a call, let us know. That's what we're here for. We're here to help you find the supports that you need in the home. And then also contact your managed care organization. And so they typically have member services numbers at the back of their card. And so if, contact them and see if they can also make referrals to us for CFC. We get approximately about 5 to 6 referrals from them each month. And that basically just lets us know, like, hey, we spoke with this member and we think that they may be good fit for CFC. So then they contact us so that we can get them assessed and see if they meet that eligibility criteria. And then if they do, then we would kind of start that enrollment process for them, depending on their age. Again, if they're under the age of 21, then we would send that referral back, let them know, yes, they do meet the qualifications. And then if they're over 21, they would be assigned to a service coordinator with us. And then we would provide that ongoing targeted case management, as well as completing that functional assessment. And so that's really all I had. I didn't know if.
Yeah, there's a couple of good questions from that. So kind of in that same vein about you mentioning to contact you all there at the local authority to apply for the for CFC. But one of the questions was, what department can the parent contact with to apply for CFC for a child currently not having Medicaid or not receiving any waivers yet? So I think, like you were mentioning earlier, that kind of goes back to, you've got to have Medicaid before you contact. If you don't already have a waiver, either way, you're going to need to be qualified for Medicaid. So if they live in Fort Bend County, who would they contact to see if they qualify for Medicaid? I want to say, isn't it My Texas Benefits? Let me look that up real quick. I
Either
think
My Texas Benefits or yourtexasbenefits.com.
Yeah.
Your Texas benefit.com.
Okay, so it's Your Texas Benefits. Okay. Yeah, there it is. yourtexasbenefits.com. So let me go ahead and I will put that in the chat, because I just couldn't remember if it's my or your.
And also, I know that kind of just navigating through Medicaid benefits and trying to make sure that you have all the correct paperwork needed to, to send off, it can get really daunting and really confusing. And so if you do need help with, Medicaid eligibility, or just kind of going through that process, you can always contact our front door intake. They're there to answer any questions for you. I know Medicaid and just navigating through that can be really difficult sometimes. It's a lot of paperwork, a lot of reading. And so contact your local authority and just let them know, like, hey, I'm trying to apply for Medicaid and I need some help. And if you have questions or anything, we'll be more than happy to sit down with you and just kind of go through that process with you.
I'm sorry, my question, I want to clarify my question, because I was learned if a child qualified for one of the waiver, then the waiver may get the child qualified for Medicaid as well. So since CFC, I'm not sure, should I call CFC a waiver? Maybe it's not a waiver, but I'm just wondering if the child qualified for the CFC, can that CFC also made the child be qualified for the Medicaid? That's why I'm wondering, can the parent contact test centers intake department to apply for CFC at the same time to apply the Medicaid? That's my question.
So typically, when someone is received their slot for a waiver, for like HCS waiver, and if they don't have Medicaid at that time, our enrollment department assists with applying for Medicaid because they are enrolling in a waiver. Most of the times they get approved and then they can enroll in the waiver. But when we're talking about CFC non-waiver or CFC on its own, that's not typically the case. So again, you haven't started the process to kind of apply for Medicaid, start that process. And if you need assistance, feel free to contact our intake department.
Okay, so the intake department's phone number is not this number on the slide that you're showing right now?
No, and Carrie, I'm not sure. Do you have Mary Sotelo contact information?
I'm gonna put in the chat right now. Let me
That's fine. I do have the number, but that's okay. Thank you, Carrie. But you can post it maybe part of Paranetic.
Yes,
It should be
absolutely.
1363. 13.
I'm giving just the general intake, the general intake
okay.
line,
Not
the
to-
front desk. Yeah, so
Okay.
not to Mary Sotelo herself, but
Okay,
Yeah.
got you. All right.
yeah. So that's my understanding as well. From your question about the Medicaid, is that even for these HCS waivers, if you get a call from Texana, great, your number is up and we have your child up for Texas Home Living or HCS, that you still have to qualify for Medicaid. So that's my understanding as well. You still have to go through the applying for Medicaid for the person, whether they're a child or an adult. Now, the problem comes with most children tend to not qualify for Medicaid because of their parents' income being counted. So that's why, but I know there's exceptions too. So that's why we always want to defer, contact Medicaid themselves and ask them whether or not they qualify, because there's always little exceptions here or there, based on things that we don't even know about. We don't run the state program. So to get the most valid information about Medicaid itself, it's best to talk to and go through the process of applying for Medicaid and talking to Texas Health and Human Services. They're the ones that run the program. That's going to be your most valid information on whether your child or adult qualifies for Medicaid and if there's any exceptions to that. So I know it's yourtexasbenefits.com. I was going to look and see if I could find any kind of phone number too for them. So I'll keep looking for that. In the meantime, I know there were some other questions there in the chat. One of them was, how long is the typical wait for services to begin with CFC after meeting with the doctor and getting approval of the admission to the program? So that's another question.
Yeah, so once they've gone through the process, you have a psychological evaluation. Typically, once we send off the approval to the state, it typically takes about 2 to 3 weeks. And then once you're approved, we have our service. If you're 21 and over, you will have a service coordinator assigned to you. They'll contact you and do your initial enrollment meeting within about 10 days of getting the approval. Most of the time it's shorter, but at least making that initial contact, and then of course seeing what your availability is. That initial enrollment meeting typically takes about, I would say about 2 hours. And so you definitely want to do it in a setting that's comfortable for you. Service coordinators can come out to the house to do the assessment, or you can come here to the office. But it's very lengthy. It's a 21-page assessment, and it goes through in detail through several tasks and outlines basically what your child can do for themselves, what they can't do for themselves, and if there's something that they can't do, why can't they do it? And then also it goes through what else would they want to, what are some things that they want to work on? So again, going back, adding that habilitation piece to it is what skills, like brushing teeth, you may have to do it for them sometimes, but then that's something that you would want for them to learn how to do it on their own. And it's not always a skill that they have to master. It could be something that you just want to constantly work on, ongoing training with them, because what skills they do have, you don't want them to lose it. You want them to maintain it.
Right. Very good. And in the meantime, I just looked up and posted the Texas Health and Human Services, the phone number for the ombudsman. I didn't find like just a generic phone number for Medicaid, but I would probably try just through your texasbenefits.com, going through the website and that process. And then if you happen to have questions, there is the ombudsman there for Texas Health and Human Services to help you with the Medicaid application process if you run into any snags online or qualification and whatnot. So another question was, if my child already gets personal assistance services, can he receive the habilitation services?
So if you're already receiving, I think it's PCS or, something like that, you can also, most likely you would qualify for CFC as well if you're already receiving that. But you would have to apply for CFC separately in order to get that habilitation piece added on. When we first started, I think that was a lot of questions that we had from families, because we, from the referrals that we received from the MCOs, we were contacting families and say, hey, your MCOs referred you for CFC. Are you interested in enrolling? And a lot of the families were, well, I already get something like this. I already get, personal attendant services in the home. So what's the difference? The biggest difference is that habilitation piece to it. And the emergency response services and the support management, of course. So we can't guarantee that if you go to CFC, you would get more hours of in-home supports. So, but typically, because you're also adding on that habilitation piece to it, we've seen, an increase in the hours that they're receiving on a weekly basis. But I cannot guarantee that.
Right. So what would be the process for those who are currently receiving the personal care services and they want to see or qualify? They would contact you all there and apply then?
Yes.
For CFC?
Mm-hmm.
Okay, so very good. Another question. Oh, go ahead.
Okay, because I just did that 2-hour application for him to get the personal care services with, and I do use an outside person, like to get my family to get paid for it through Medicaid as well. So would that be an issue then? Because he just got reapproved for the next year with that.
No, that won't be a problem. and that happens, often too. But the one thing about, CFC is that, it's a Medicaid entitlement program. So there's no wait list. There's no, once you're out, you're out. If you want services today, like I said, give us a call. Every situation is different. So we have to assess, where, what services you're currently receiving. And then we have to find the best route to kind of transfer those services over to CFC if that's what you want. And then if you're like, no, this is not for me, I don't like it, then we can talk about, kind of getting you back to where you were. But, and then if you're like, no, I think I like CFC better, you can always jump back and forth. And so that's the thing with CFC non-waiver, is that you have that flexibility to do that. And like I said, contact your local authority, contact us, and then we will definitely walk you through that process. I hate that I'm giving, such general information, but, whenever we get phone calls from families and things like that, every situation is different. So, yeah, even though you did that, assessment, and if you're interested in CFC, contact us, and then we can see what we can do to kind of get you switched over.
Oh, good. Another question was, how do you find out if the report has been submitted to the state? They completed their report. The report was completed in January of 2023. So how do they know that that report was completed? And then another follow-up question was, do you get a copy of the report that was submitted?
And I'm assuming that you're talking about the psychological evaluation. So if you want a copy of, excuse me, if you want a copy of the psychological evaluation, again, contact us. Typically our psychologists mail out a copy, but it does take them a while to even write up, the report as well. And so if you had an appointment, in January of 2023, I would expect that you would start receiving a copy of the report in the mail mailed from us. If you haven't yet, again, contact our intake, and so we can see what we can get you a copy of that. And then if you are specifically interested in CFC, but that wasn't, talked about during the appointment for the psychological evaluation, again, you'll have to contact us and let us know, because, a lot of people come in for psychological evaluations for different reasons. And so if you're not saying specifically, I want CFC, then we won't know that we need to start that enrollment process with you.
Okay, great. And she was saying that, yes, to all the questions about, yes, it's for the psychological, and it was for CFC specific.
Okay.
So, and there's another question. Do you accept the KDISD organization or their district intellectual test in school district report testing?
Unfortunately, we can't. It has to be done, again, not me, but the state says if you're going to receive any type of state funded services, it has to be through your evaluation has to be done by a state authorized provider. And so if you already had an evaluation done by the school district, definitely, bring in that paperwork with you. It really helps our psychologists get a full picture of what the needs are for your child. So, but no, it has to be a separate report.
Okay, yeah. Typically those school district evaluations are based on educational need, and although they may be doing some of the similar tests that maybe the local IDD authority will perform, school district LSSPs may not necessarily have the same qualification as the local IDD authorities. Psychologists, so it's psychiatrists, so it really is, it's a different test. school districts and their evaluations are not the same as what the local IDD authority, may perform. They're looking at kind of different. They're looking at different things. But that's a great question. Lots of great questions here today. Don't see any more in the chat. Any other questions? Feel free if you want to unmute, you can ask, or if you want to pop another question there in the chat box, I'm happy to read it for you. But Maribel, in the meantime, just kind of soaking up all the information you've given us, and hearing you say kind of at the end there that this is it's a Medicaid entitlement program. So that's why it's so timing. Qualification for Medicaid is kind of the door that opens to getting into CFC. So I think that's kind of why all roads lead to still back to the Health and Human Services and getting qualified or applying for Medicaid to see if you're qualified. Yeah. Okay.
Yeah, definitely, being eligible for Medicaid and having Medicaid does open a lot more doors for in-home services and supports. So if you haven't started that process, definitely that would be, the first thing that you would want to do.
Okay, and again, we do have that information on there on the chat. The website in order to apply for Medicaid is yourtexasbenefits.com. The Texas Health and Human Services, the phone number for the ombudsman, if you do run into any problems accessing the website or finding out about how to apply for that Medicaid, the ombudsman's office, their phone number is 877-787-8999. And then from there, once you are qualified for Medicaid and you're ready to apply for Community First Choice, then is when you would contact the local IDD authority. But in the meantime, if you have questions, contact Texana. Their intake line is 281-239-1349. And then also there, as you see on your screen, you can reach out to Maribel. Her phone number and email address are there. Her number is 281-238-1871. Or also Anna Huerta is, so that's the team lead there for Community First Choice. And her phone number 281-238-1839. So you've got some great contacts there. And let me see, I don't see any other questions coming in the chat at the moment, but Maribel, thank you so much for coming and giving us this information. It's very helpful.
Thank you for having me. I appreciate it.
Very good.